Today we're talking about hormonal headaches, in particular perimenopause migraines, and what you can do about them. I'm Dr. Shelley Meyer. I'm a functional medicine doctor, registered dietitian, and family doctor, and I come to you on this channel trying to help for hormonal balance and gut health and metabolic health, all things in between. So I do this the kind of thing every day in my functional medicine practice. If you want more information about that, check out my links in the description. But I've mainly been focusing on this channel lately in the last couple months on perimenopause and hormonal shifts that happen in late 30s to mid 40s, early 50s for women. There can be a broad spectrum of ages. So today I wanted to talk about hormonal, sorry, adjust my notes there. I wanted to talk about hormonal headaches, in particular perimenopause migraines or migraines related to perimenopause. I wanted to talk a little bit about where hormonal headaches are located, what they can be. Are they always migraines? No, sometimes they're cluster headaches. What it can mean what it can mean when you wake up with a headache, and then what you can do about these hormonal headaches. So let's dive in. I've had a lot of questions about this. So basically, hormonal headaches can happen throughout the menstrual cycle. It doesn't throughout the ages of a menstrual cycle. It doesn't have to be just at perimenopause. It's just that some women can feel worse at perimenopause. So when your levels of your estrogen and progesterone fall to their lowest level right before you have a period, whether it be in perimenopause or a regular period, you can have a hormonal headache associated with that. You can also have headaches in pregnancy because of the estrogen levels rising. And then, so speaking of the estrogen levels rising, on this channel, I've talked a lot lately about estrogen dominance being the first phase of perimenopause. So along those lines, you do have estrogen rising and sometimes roller coastering around a bit, and that can trigger these perimenopause migraines or headaches. And then also another potential cause is oral contraceptive. So women taking the pill, taking birth control pills, or even taking hormone replacement therapy can cause menstrual migraines or perimenopause migraines. Although when you're taking those for perimenopause, a lot of women do that. It's kind of like you're not really in perimenopause, so it's more of not a menstrual migraine or a perimenopause migraine. It's more of a headache related to actually taking the hormone. So there's some different causes of hormone-related headaches. Let's talk a little bit about some other contributing factors, because we don't always want to assume that it is your hormones. So a lot of women are skipping meals, fasting maybe. That's fine. It's good and healthy, but in a lot of ways, but sometimes if it's done the wrong way or if it's not right for you, you might get a headache related to that. You can also get it from getting too much or too little sleep, usually too little sleep, and that can happen very frequently in perimenopause. If you don't know about that relationship between the dropping progesterone and the roller coastering or dropping estrogen, check out some of my other videos on actual perimenopause and how that relates, like what it does to your hormones. So sorry, my chair is very, very squeaky today. I think I'm missing a screw on it. But anyway, you can get headaches when your stress increases, and we do see increased stress and anxiety in perimenopause. So there is that relation, even though it might not be directly from the actual hormones causing the headache, they're indirectly causing it. Alcohol, like red wine, and especially in perimenopause, we can get more sensitive to alcohol, so that could trigger headaches. And then you have other things like processed meats and MSG that may have triggered your headaches regardless of where you are in your hormone cycle. But those are other things to think about. Artificial sweeteners is one too. So symptoms of hormonal headaches, they can be different. So we've got like cluster headaches, which can happen in like short burst clusters around here, almost feeling like a vice on your, like something squeezing your head. So that could be one type of hormonal headache. You can get cluster headaches, and they're like short bursts, and they then will go away and then come back maybe later. Migraines would be more persistent, and those can happen on both sides of the head. They can happen in the back of the head. They can happen up here. Everybody's got like a little different of a pattern for their migraines. And so, like I said, either one of these can happen at that time frame right before your period, whether you're in perimenopause already or you're just having regular periods that aren't irregular, like we see in perimenopause, you can get those headaches right before your period. So if you feel that, and then you feel any of those symptoms, so migraines, you'll be more sensitive usually to sights or sounds or smells and want to sit in a dark room and lay down, and that'll be a more prolonged thing, whereas the cluster headaches are short bursts of headaches. So that's kind of how you know the difference between them. It's always best, though, when you're having a headache, a new headache, to see your doctor, because this is not medical advice on YouTube. I can't give you medical advice. I don't know you personally. I'm not your doctor, so this is not considered medical advice. It's just to help guide you. So if you have a new headache, it is always best to see your doctor, because you may have something more serious going on, something in the brain that needs to be checked out. So don't always assume that it's a perimenopause related or menstrual related headache. So other symptoms that are weird that usually, you don't associate with headaches, but can go along with hormonal headaches, are like acne, constipation, because you can get that during certain times of your cycle. Nausea does go a lot with migraines. So you may experience some nausea before your headache, or some kind of change in your vision before your headache. Definitely always talk to a doctor about that, though, because you want to get that checked out. You can also have cravings for sugar, alcohol, or chocolate associated with the hormonal headache. So those are interesting things to think about. And then sometimes, what about waking up with a headache? We can see that with hormones sometimes, but waking up with a headache can also be related to poor sleep. So you can have poor sleep in perimenopause, like I've talked about multiple times, due to estrogen dominance or estrogen deficiency or the progesterone dropping. So check out my sleep-related videos. But you can also wake up with a headache from poor sleep due to sleep apnea, and that could trigger headaches. So if you snore, wake up feeling super tired even though you've gotten, a decent amount of sleep as far as hours go, or fall asleep easily during the day, any of those things, I would check that out with a sleep study, or your partner or anybody that's witnessed you sleeping says you gasp for breath and you kind of wake up gasping for breath. I would definitely have a sleep study done, and they can do those at home now, because that can definitely affect your headaches. So that's another thing to consider. And then, so what can we do about these headaches? We'll definitely want to practice all the, natural treatment, steps in your life you can take to either stave them off or help take care of them after you get them. So drink plenty of water. You want to drink at least half your body weight in ounces of water every day. And then especially drink more when you have a headache. You want to, of course, lie down in a dark, quiet room if that helps, or put sunglasses on. Place an ice bag or a cold washcloth on your head. Massage the area where you feel the pain. And then deep breathing is super, super helpful, deep breathing exercises. So I definitely recommend those. And I've talked about the different guided meditations. Apps that I use, they also have deep breathing exercises, or you can do them your own. Breathing in for 4, holding for 7, and exhaling for 8. But if you want to be guided, I'm really loving the Aura app, and I will put that link in the description, because you can get it's 25% off through that link, and then have that free trial. I love Aura. I like Calm also, and there's plenty of other apps. There's also biofeedback. You can go to a biofeedback practitioner, or you can do biofeedback on apps like the Inner Balance, Heart Math. I use Heart Math a lot. Even your watch, if you have a smartwatch, can have some, dialed down, basic biofeedback where you follow the heart or follow the whatever visual they put on there to focus your breathing. So that can be helpful when you're having a headache too. And then some of the supplements that I found most effective, number 1 for hormonal headaches or migraines, is magnesium. So if you have a problem with constipation also, you probably want to get a magnesium citrate or a blend with citrate in it. And I'll put some links in the description, as I always do. But if you don't have constipation, or you have looser stools, you probably want to do magnesium glycinate, which doesn't affect the stools as much. So I'll put my favorite down there. There's one called triple magnesium that has actually glycinate and citrate in there, so it's kind of the best of both worlds but if you have looser stools, you want to just go with the glycinate. And you can titrate up. So that what that means in medicine is, you know, start with, let's say 100 to 200 milligrams of magnesium if your doctor feels that's appropriate for you, and then gradually go up to like 400 to 800. That's what we do a lot of times when people are having headaches. We can take it up to like 800 as long as their stools tolerate it, they're not having like diarrhea or anything. And that can often help menstrual migraines or hormonal headaches. What else? Vitamin E, they have found in studies, can be helpful. So that is a fat-soluble vitamin. So you don't really want to go overboard on that. I would talk to your doctor about that and check your vitamin E levels. But mixed gamma tocopherols are the kind of vitamin E you want to choose, not the synthetic vitamin E. I'll put a link in the description. And you can also get vitamin E in nuts and seeds and dark chocolate, but you got to look for safe brands that have been toxin tested. But you could also just try to eat vitamin E rich foods to get your vitamin E during those times when your headaches are triggered. Another thing I found super helpful is feverfew, the herb feverfew. I like the Vital Nutrients. I don't know if they're still making it. I'll put a link in the description, but there's different companies that make feverfew, the herb. Super helpful for migraines and even hormonal headaches. So always talk to your doctor before you start taking anything, or your healthcare provider, your naturopath, whoever you see. But feverfew can be very, very helpful. Oh, if you are estrogen dominant, definitely look at my estrogen dominant videos, because you may benefit your headaches may benefit from DIM, which I use quite often, which is a derivative, like it's found in broccoli, but you'd have to eat way too much broccoli. Your stomach wouldn't handle like pounds and pounds to get what you would get in the supplement. So DIM can be very helpful. Ginger can also be helpful. Bromelain, which it helps to break down. It's like an anti-inflammatory, basically a natural enzyme. You want to take it in between meals and not with meals. Riboflavin, vitamin B2 is another one that's super helpful with headaches. There are some blends, and I'll try to put one in the description, that have feverfew and magnesium and vitamin E. You might not have the vitamin E, but bromelain and B2 in there. And then you also want to make sure you consider, is it tension in your neck? So either way, even if it's not tension, massage may help. Acupuncture can definitely help balance not only tension, but your hormones and help your sleep. So that's something to consider too. And then when people are having a migraine, if they drink caffeine, and even with hormonal headaches, that can help. So I have people that just go out and get a tea, chai tea. You know who you are if you're listening, you're watching. Even though that can have a lot of sugar, it can still help the headache. So something just right in the moment could be caffeine, but having too much caffeine can trigger the headache. So it can be a good treatment, but not necessarily good preventive wise. So I hope that's helpful. I'll put any helpful links in the description, and ask me any questions. I can't give you individual medical advice, but general questions I can look at I can try to answer in the comments. And I'm trying to do these videos now every 2 weeks because my schedule is pretty crazy. I'm trying to become uber focused on what you want to hear, or want to learn about. So I love you putting that in the comments if you could tell me what you want to learn more about. In fact, this video is based off somebody asking something in the comments. So hopefully this was helpful, and I will see you next time.